Good evening. Today I'm going to be talking about a subject that is near and dear to me. It's a medical condition usually found in males called hydrocele. And usually the condition is found in young males, usually when they're being born around the age of 8 months of gestation time. And basically what the definition of hydrocele is, it's a painless buildup of watery fluid around one or both of the testicles that causes the scrotum or the groin area to swell. And I found this information on WebMD.com, and it was referenced by HealthWise on their internet site. Basically, the symptoms of hydrocele is caused by, they really don't have any cause or symptoms that you can find directly related to this condition. But however, the enlargement of the scrotum is usually caused with pain, swelling, or redness of the scrotum, or feeling of pressure at the base of the bladder and the groin area. This has also been referenced by WebMD.com and through HealthWise. How doctors can diagnose what hydrocele is because they can go through a process called transillumination. And transillumination is where the doctor will shine a light on one side of the testicle wall. And if the light passes through the wall and he can see the light reflecting through, then it's considered benign. However, if he sees shadows or figures in the testicle wall, that could be considered cancerous or a blockage. And what I wanted to also relate in this information is that one of my sons recently was diagnosed by his doctor as having hydrocele. And so this is the reasons why I took personal interest in researching this. Moving on with the treatments of hydrocele, what the doctors usually can do is do a surgical procedure called hydrocelectomy, and that's basically the surgical procedure for removing the fluid buildup. Another thing they can do is use a needle and insert the needle in to draw the fluid out, called aspiration. And thirdly, in men that are age 65 or younger, usually the fluid can go away by themselves. But in particular, in most cases, if it doesn't go away after they turn 12 to 18 months, that's when usually surgery is required. And like I discussed briefly, the cause of hydrocele usually occurs after the testicles drop into the scrotum around the 8th month of pregnancy. It can be caused later in life by injury or surgery to the groin area, inflammation or infection of the epididymis or testicle area, or cancers of the testicle or of the left kidney. And this information was researched by the Texas Pediatric Surgical Association and WebMD.com when I went online to reference, and it was also referred by HealthWise. And basically, with the conditions of hydrocele, in conclusion, I would just like to say that with young men, it's important to have regular checkups, but it's very important for mothers who are having newborns to have their checkups, to have their procedures done, to make sure that there's no abnormalities going on the forming fetus. But also, men should take care if they're going to be active in sports or they're going to be participating in high impact activities. They need to make sure they protect that area and protect themselves to prevent any damage. And that concludes my speech. Thank you for attending.